Hi everyone! It is Wednesday again. Another week has passed and it is amazing how fast time flies when you're having fun. So I'm here to provide you with your 2-minute skincare drill, which I provide on Wednesdays. For those of you who don't know me, my name is Claudia Cometa. I am a pharmacist and independent skincare consultant, coming here every Wednesday to bring you tips and tricks to achieve the best skin of your life. So in response to a few questions I've had recently about scars, I thought I would do a couple-minute drill on what scars are, what types of procedures and tips you might have for after a scar takes place, and what you can do to minimize the appearance of scars. So a scar is basically the disruption of collagen, and there's two basic types of scars. One is a raised scar that's also called a keloid scar, and that typically occurs when there is an overabundance or overproduction of collagen. So it's the opposite of what we would typically think of when we have a more concave or indented scar. So too much collagen has built up, and typically with keloid scars, you're looking at more of a treatment like injectable steroids or even surgery to handle those. There's not really much over the counter you can do for keloid or raised scars. On the other hand, your more traditional scar, which does not keloid up, so just a typical scar, is typically due to a lack of collagen, so the other end of the spectrum. For those, there are a few options that you can do to help minimize the appearance of those. First and foremost, though, after you have some type of an incision, especially if there has been stitches involved, you're going to want to make sure that area stays clean, especially for the first week or so. You're using a topical antibiotic cream. That may be Neosporin, or it could be a prescription version such as Bactroban. So some type of antibiotic cream to prevent infection. You're going to want to keep that covered, and you're going to want to keep it protected from UV damage, so protected from sunlight and using sunscreen and keeping in the shade as much as you possibly can. Those are tips just in general, lifestyle wise, to keep that scar healthy. In addition, if you are really active, play a lot of sports, you're going to want to be careful with that scar that you're not ripping it open and you're not creating a larger opening or wound. So be careful in that area with lifting or stretching, whatever might open up that wound. With regard to non-keloid scars, since it is due to more of a lack of collagen, most of the over-the-counter products are not going to be extremely effective. Vitamin E has not been shown to be very effective, and Mederma has had some differing opinions as far as how effective it is. It's actually based on an onion extract that does reduce some inflammation, but overall, no robust literature to support anything over the counter with regard to that. What can be helpful is something that helps to induce collagen. So since we know the primary issue is a lack of collagen, if we can induce collagen, we can definitely help with that scar. So a procedure such as microneedling could help. Definitely keeping it moisturized is going to help. And so that microneedling is going to help with collagen induction. And that's something to consider with the use of retinol. So I hope that was super helpful for you. If you know of anybody that this might help, feel free to share it. If you personally have any concerns about scars and haven't had a lot of success with over-the-counter methods, feel free to message me and I'll help you out with that. Otherwise, have a wonderful week, and I will see you again next week.